comments. My concern is obviously how chilling the testimony, Mr. Baker, was about waiting lists and the effect on people and their health. And my question is really about the kind of innovation that is necessary to continue to deliver the highest quality care to patients. And if Dr. SIKORA is still listening, I'd like to hear his comment. I'd like to hear your comment as well. How do you see in the UK, and then maybe we'll go to Mr. Baker in Canada, the ability to use new procedures, to try new cancer therapies, for example? Obviously, those are often more expensive because they're new and they're untested. How do you see a national plan affecting the ability of physicians to be able to try these new treatment techniques, use the higher cost, particularly with regard to cancer, and comparing the survival rates of cancer between the UK and the US? If you could comment, please.
Sure. I mean, there's been some very good comparisons of drug use across European countries that were collated and published just after in January of this year. And it's very clear that because of the way in which we bureaucratize whether a drug will become available to a cancer patient through NICE, sort of rationing organization in a way, health technology assessment, we're falling way behind over the last 3 years our European colleagues on the mainland. And that means that over time, cancer survival, which was already low in Britain, will drop considerably compared to the rest of Europe. I think the real issue is how you can get things moving. And I think doctors, my generation of doctors, have felt their control over the destiny of patients, and indeed their own destiny, has gone down as the system's got far more concerned with looking in at costs, trying to rationalize costs, trying to make comparisons. And that's one of the problems, that it's individual freedom disappears in there, and that causes a lot of concern. Now, the other problem that you end up with, and certainly I can see you have it in Canada, regional variation. So, and even on a very small scale, so one patient living on one side of the street may go down a referral path that will allow them access to certain drugs and certain expensive, innovative treatments. On the other side of the street, they may go down a different route and not get them. And that's really a problem, that then a sort of geographical inequity comes into it. So, the problem with government systems, I think, is the lack of any incentive to move forward, to embrace innovation, which is one thing your country has really done in health technology.
Thank you very much, Mr. Baker. Your comment on not only just being able to get treatment, but the quality of treatment with using the ability to use innovation to really find new ways to cure disease.
Well, I'll tell you a story that I found chilling. I got a call from a gentleman in Newfoundland, one of our poorer provinces. His father has a blood condition. He really needs a bone marrow transplant. This is impossible in Newfoundland. It's impossible in many parts of Canada, but this is what would save his life. Alternatively, he's having weekly blood transfusions, and he's been doing this for going on a year. The doctors recently told his son, we're going to have to stop these transfusions. And he said, well, wouldn't my father die? And they said, yes, he ultimately will. And they said, why are you stopping it? Well, we can't keep giving him transfusions forever. And we don't have the money to pay for him to leave the jurisdiction to go to Boston, for instance, to have the bone marrow transplant. System in Canada, and it will happen here too, the people who deliver health care become hardened. They become immune to these sympathetic stories that normally you and I would feel so sorry for people. They're hardened to it, and they have learned just to tell people, no, it's not available, you cannot have it, move on to the next person. And I haven't been able to do that in my own business, but fortunately I haven't had to, because I do have this access to the U.S.
I was surprised to find out that the medicines that might be available to you depend on your zip code, where you live. Did I understand that correctly?
That's correct. Each province has its own Ministry of Health. They have their own budget. They have their own taxes that contribute to these budgets. If the budget is gone and there's no more money, the only way is to cut off access to more expensive procedures.
Ms. Brown.
Thank you very much.